Okay, so why don't we begin? Hello, everyone. Welcome. My name is Amy Sam. I am the co-chair of the Mass General Council on Disabilities Awareness.
Hi, Colleen, you're muted. Sorry.
Of course I am. Hi, everyone. I am the other co-chair on the Council of Disabilities Awareness. My name is Colleen Kelsey. Thank you all for joining.
Thank you. Today's event is part of our Disability Awareness Education Series. This session is being recorded and will be made available online for later viewing on the MGH Equity and Community Health YouTube channel. If you have any questions for our panelists today, please enter them in the Q&A box located at the bottom of your screen. Colleen will help moderate them towards the end of the session. Please do not share any personal medical information or questions in the Q&A. If you have a personal medical question, please ask your doctor. So next, I am going to turn it over to Zara Emir Hosseini, who will like to share a few words.
Thank you, Amy and Colleen. Each year, millions of Americans face the reality of living with a mental health condition. And we know that mental illness affects everyone directly or indirectly through family, friends, or co-workers. The stigma around mental health and treatment has long existed, and still people hesitate to seek help and even talk about it with their loved ones for the fear of being judged and facing unnecessary backlash. We believe that mental health conditions are important to discuss year-round, but highlighting them during the Disability Awareness Month provides us with an opportunity to come together as one unified voice. This year's National Alliance for Mental Illness, NAMI, will highlight the theme Together for Mental Health, which focuses on the importance of advocating for better care for people with serious mental illness. Our hope is that by doing presentations like this, we will not only raise awareness of the resources available, but to foster a safe environment where anyone affected with mental illness will have access to quality health care and the support they need to live healthy, fulfilling lives. On a personal note, I would like to thank Amy and Colleen for putting this presentation together. Enjoy the presentation. Amy?
Thank you, Zari. I also wanted to give a special thank you to our sponsors of today's event, the Mass General Council on Disabilities Awareness, as well as Mass General Equity and Community Health. To our guest panelists, to Susan Muller-Hershon and Kim Sampson for providing ASL interpretation today, Captioner Kate for live closed captioning, and Ashish from Collaborative Media. Next, I would like to introduce you all to our guest panelists. Joining us today, we have Dr. Christina Temis. Dr. Temis is a staff psychologist at the MGH Daunting Center for Bipolar Treatment, Innovation, and Primary Care Psychiatry Services, a consulting psychologist at Spaulding Rehabilitation Hospital, and a Harvard Medical School instructor. Her research interests include the development and course of personality disorders, characterization and treatment of self-destructive behaviors, and the impact of mental illness on physical morbidity and mortality. Joining us today, we also have Karen Potter. Karen has worked as an inpatient social worker at Spaulding Rehab for the past 9.5 years. She provides support to patients and their families, including those who have recently been hospitalized for serious illnesses such as stroke, neurological diseases, brain injury, burns, amputations, and other physical trauma. Lastly, joining us, we also have Owen Wyatt. Owen is a licensed mental health counselor with a master's degree from William James College. Prior to joining the Mass General Brigham Employee Assistance Program in 2021 as a counselor, he was the Director of Mental Health at Northeastern University's Health and Counseling Services in Boston, Mass. He also has worked as a counselor at the Berklee College of Music's Counseling and Advising Center, Owen brings over 10 years of professional experience to the Mass General Brigham Employee Assistance Program, also known as EAP. So please join us in welcoming them next. Next, I'm going to turn it over to Dr. Temis, who will begin her presentation.
Great. Well, thank you everyone for having me. I really appreciate the opportunity to speak. Let me just pull up my slides. Okay. Great. Okay. As Amy had mentioned, I'm Christina Temis. I'm a clinical psychologist both at Mass General and Spalding Rehab Hospital. Obviously, the topic of mental health is quite a large one. So I thought I would focus on a few areas that seem particularly relevant to our current times, particularly during the COVID-19 pandemic. And specifically, I'll be touching on sort of the overall prevalence of mental health conditions in the US and the impacts that these conditions have in terms of cost and also impacts on individuals, families, and our community at large, to really emphasize the importance of awareness and treatment for mental health conditions. I'll also be talking a little bit about how the provision of mental health services has changed over the course of the pandemic, specifically the emergence of more telehealth modalities for behavioral health care. And then finally, I'll be talking a little bit about mental health among healthcare workers specifically, although some of the resources I'll highlight will be helpful, I think, to people who are not healthcare workers or maybe other folks who feel disproportionately impacted by the pandemic itself. Okay. So I wanted to start by really highlighting the prevalence of mental health conditions in the United States. And this graphic over here on the right is from the Kaiser Family Foundation and uses data from the fall of 2021, specifically looking at anxiety and depression. We may think of other mental health conditions as well, but really highlights the prevalence across the US at that point in time of these conditions. And you'll see about 1/4 to 1/3 of individuals, depending on the state, describe having some experiences consistent with depression or anxiety. And these figures represent an increase over time, but are consistent with other studies of the prevalence of mental health conditions in the US. And, so we can imagine that sort of a similar proportion of the participants here today may have been impacted by these mental health conditions themselves, or at the very least know someone in their family or social network who has been impacted. In terms of sort of this period of the pandemic itself, research is showing that the rates of mental health conditions and difficulties have increased over the past 2 years. And that, in addition to sort of these increases in rates of mental health conditions, we're also seeing a lot of difficulty in terms of people accessing mental health services. And the reasons for this are many, but include having difficulty finding providers who have availability, having difficulty affording mental health care or getting the appropriate reimbursement from insurance companies, having to take off work or take away time from family care in order to access these services, and that being difficult. And also the stigma associated with seeking mental health care, acknowledging a need for help. All of these are common barriers that have gotten in the way of people being able to access the care that they need. Other outcomes that we've seen over the pandemic that have been particularly troubling have been increases in overdose deaths, representing some increases in substance use. Even outside of the pandemic, we've seen some increases in suicides over time over the last several years. And we know in terms of financial costs that there's a real financial cost in terms of insurance spending with people that have mental health conditions in terms of higher rates of usage compared to those without. We also know in terms of overall disease burden that mental health conditions represent sort of the highest disease burden among health conditions. So that means time away from work, costs associated with care, relationship with other forms of physical illness, and mortality. So these are really serious kind of conditions that are very prevalent, very common, and so really require a lot of resources for treatment as well as awareness among the population of the prevalence of these conditions. This slide comes from NAMI, which Sari had discussed in the intro, which is a wonderful organization focused on mental illness. And I think really kind of highlights how mental illness doesn't just impact the individual that is experiencing depression or anxiety or bipolar disorder or psychosis, but also has ripple effects beyond that person. So even within the individual, we know that having a mental illness, particularly serious mental illness such as bipolar disorder or psychosis, is linked to other forms of chronic disease, some cardiovascular risk, potential co-occurring substance use disorders. For families, for particularly people with serious mental illness, there is often a large caregiving burden, with at least 8.4 million Americans providing care to an adult that has an emotional condition or mental illness, and that translating to a lot of unpaid care hours. In our community, people that are unhoused or homeless, incarcerated, as well as youth in the juvenile justice system, are disproportionately, or people with mental illness are disproportionately represented in these populations. Additionally, a lot of emergency room visits are due to people in a mental health crisis. And we know on a systems level that dealing with emergency department capacity throughout the pandemic has been a real issue and a health crisis in and of itself. So this is sort of an important impact to keep in mind. And psychiatric patients are often boarded for a long period of time in the emergency room, impacting their own ability to access care as well as sort of the overall capacity of the ER. And in terms of sort of larger societal impacts, we already discussed sort of the disability that goes along with mental illness, as well as the disease burden on society and our overall kind of productivity, as well as the costs associated with these sort of lost hours of productivity and other costs for maintaining our healthcare system. There is sort of an emphasis in terms of our overall political landscape and sort of emphasizing mental health. So in the State of the Union address last week, there was a shout out to mental health services and just the importance of increasing access as well as parity. So reimbursing mental health services at the similar rate as physical health problems. So we'll see where this goes, but I think it's important to highlight that has reached the national stage in terms of seeking some awareness of the importance of addressing mental health. In terms of general resources to maybe think of checking out if you yourself are maybe struggling with a mental health condition, are interested in learning more about mental health, or are supporting someone that might be struggling with some emotional difficulties. I think this is a pretty good list of some general resources. So the first being the NAMI website, which has a lot of great information about mental illness in general. There are also support groups offered through NAMI for people who are living with mental illness, as well as family members or friends supporting those individuals. SAMHSA is a government agency that also has a lot of resources about how to access care. There are particularly great resources about substance abuse and accessing substance use treatment services. The National Suicide Prevention Lifeline provides crisis services for people that are maybe contemplating suicide or are in some mental health crises. Their website has information about how to access their hotline and also has a lot of resources for supporting other people in your life who may be going through a mental health crisis. Similarly, the Domestic Violence Hotline has resources for people who are experiencing domestic violence. We know that the rates of these incidents have increased during the pandemic. So there are similar hotlines and text lines, as well as resources for supporting people going through these experiences. And the World Health Organization also has some great resources at their Mental Health Day page. I'm going to take a little bit of a turn and talk a bit about some changes that have occurred to our provision of mental health care during the pandemic, specifically increase in the use of telehealth, and how that's important in terms of changing our access to mental health care services. So we live in a pretty tech-heavy world, so there were a lot of resources that were available before the pandemic to provide telehealth services, but they were really underutilized. And the pandemic we can think of as almost a disrupting force that led to the rapid implementation and use of telemedicine, particularly in mental health services, which can be done quite well remotely. And previously, access to telehealth services was really limited by restrictions around privacy, prescribing, through telemedicine, as well as insurance reimbursement. So insurances wouldn't always reimburse for these services, and in some cases would not reimburse at all for things that were conducted on the telephone, so audio only types of services. The good news is that this has changed in terms of individual insurance companies and federal regulations allowing for wider reimbursement for these services. In Massachusetts, as of early 2021, there's legislation to really expand telehealth and its reimbursement on an ongoing basis, as well as having parity in reimbursement between mental health services and physical services offered through telehealth. So that's very important. We have a lot of evidence for the feasibility and efficacy of these services, and I think anecdotally, some patients prefer this for convenience of not having to commute into an office once a week or once every 2 weeks for services. If people have any physical challenges, they don't have to worry about the accessibility of getting into an office and can use that through their own home. That being said, some limitations involve just sort of the privacy of not always having sort of a private space in the home that someone can access these services and feel like it's totally private. Not everyone has access to computers or internet access or the technology needed, which is, I think, the expansion of phone services has really helped address that need. And also some clients prefer to come into the office for the structure and connection that goes along with an in-person visit. Okay. I'm going to take a little bit of a turn and just focus specifically for a moment on healthcare worker mental health. And I know Owen will be talking a bit about this later on as well. But we know that specific to the population of healthcare workers who've been working throughout the pandemic, we're seeing kind of an increase in mental health related difficulties, which can stem from a variety of reasons, including fears of contracting the coronavirus and are affecting loved ones. The trauma and grief associated with working during this time, issues of burnout, compassion fatigue, issues related to moral injury of providing care during a health emergency and perhaps not under ideal circumstances, and seeing conditions such as anxiety, depression, and substance use being increasingly represented in the healthcare worker population. This graphic just quickly is from a Heinen article on FLOS 1, which is publicly available. It's open access if you want to check it out online, but kind of gets at sort of these multiple spheres of factors that can influence the degree to which healthcare workers' mental health is impacted by the pandemic. So these include really like larger societal factors, including kind of governmental response to COVID-19, overall stigma associated with being a healthcare worker or acceptance, sort of the media coverage, institutional factors such as cohesion and policies in the hospital level, a person's own social support network and the degree to which that's available, as well as individual factors, including some socioeconomic factors, the person's specific profession within a hospital system, and their own mental health history. So I did want to take this opportunity to highlight a couple of resources for healthcare workers, some of which are also helpful for people that are not healthcare workers and available to them. So Owen will speak about the Employee Assistance Program a bit later, so you get some more information about that. In the Department of Psychiatry, we also have something called the CARES Clinic, which is specifically for MGH employees. We offer short-term therapy of capped at 20 sessions, as well as medication management. And if this is something you're interested in, you can self-refer at the number that's posted here. The Department of Psychiatry also has some great online resources that are curated to help support mental health, and I'll show a quick slide of that after this one wraps up. There's also, through the hospital, an online resilience training that is comprised of 3 videos that is also a helpful resource if you have the time to check that out. I just want to briefly preview the psychiatry website. So if you just Google MGH Psychiatry, there's a tab for COVID-19 related resources, and you can see some subsections for different populations. including healthcare providers, but also people that have children, people with ongoing mental health conditions, just general mental health and coping resources. And each of these has a host of resources that are available online that you can check out and incorporate into your daily practice as well. I think that is all for me. I really appreciate everyone's attention. I'm going to hand it over to Karen Potter, who will be talking about support groups.
Hi, I'm Karen Potter. Can you hear me?
Yes, we can.
Okay, great. So I'm going to focus more on support groups as a maybe alternative and or supplement to traditional mental health services. And let me pull up my video. Let's see. Try this. Okay. All right, so support groups. I just want to start with anecdotally. I work inpatient at Spalding Rehab Hospital, and over the last couple of years, I've worked with patients who have said that it's really been their ability to participate in a support group virtually that has gotten them through the COVID-19 pandemic. It had allowed them to stay in touch with their other people in their support group, as well as the facilitator. And some of these groups meet once a week, and some of them were once a month. And it was just really something that was very helpful to them. I have facilitated support groups throughout my career. I used to work in hospice, and I currently, where I ran bereavement support groups, and in my current position, I run some inpatient support groups. And these are just some of the things that I've heard participants say. I thought I was the only one who felt this way. My family tries to be supportive, but they can only take so much. I feel like the others really understood what I was going through, and I found out that my experiences were normal. That's pretty much the gist of it. As you can see here are some of the benefits of support groups. Okay, can you advance to the next one? And I already covered that one, so the next one. Okay, yes. So here we have just some of the benefits of support groups, and this link here goes more in detail over some of the benefits of a support group. Can you advance the next slide, please? So here at Spalding, I facilitate inpatient support groups, and they really are only for people that are currently inpatient. But just some of the examples that we provide are a stroke support group, which in fact I have one as soon as this is over, which is actually in person. We have various support groups that are connected to our specific types of injuries that people have that they're recovering from, as well as we have AA on site so that people can go once a week. And then we have people come in to facilitate amputee support groups. We like to introduce our patients to support groups so that when they go back out into the community, understand the existence of support groups and maybe encourage them to continue with that for their mental health after they leave. And then I would just recommend that if you are ever hospitalized or you have a loved one that's hospitalized, and it can be any hospital, is to check in with the social worker to see if there are any inpatient or outpatient support groups or caregiver support groups that might be helpful. Can you please advance the slide? So I wanted to kind of break down, there are many different types of support groups that exist. A lot of these overlap, but the two main different types are peer-led. So it's people who have experienced whatever condition that they are supporting, but they've been through a training to learn how to facilitate a program. So things like any of the 12-step programs, the NAMI groups, and Alzheimer's Association, just a few examples. And then there are professionally facilitated groups, and those are usually might be it's either a community or hospital staff person who has some kind of mental health degree and really has some experience with group work so that they can facilitate the program. And then within all of these groups, some of them are more educational focused, some are open-ended and they're traditional drop-in groups, although with the virtual situation that we have now during COVID, it usually involves at least you connecting with the facilitator so they can send you the link to the virtual group. There are some that are closed only to certain population, and it might be only people that are served by, say, a specific medical practice, and or they may be like an 8-week program that's specifically, for example, for loss of a spouse. It may be very specific. We have differences between in-person and online groups. I think some of the in-person groups are starting back up, but I think online is going to be with us even after the pandemic becomes an endemic. And then support groups can also be, for a specific physical or mental illness, or a specific situation, or to learn a specific set of skills. So you may actually sign up for like an 8-week program on cognitive behavioral therapy. Can you advance the next slide, please? So here are just a few recommendations if you are considering joining or trying a community support group, is to contact the facilitator ahead of time. Find out, if it's in person, how physically accessible is it? Can it accommodate hearing or visual impairments? How large is the group? That, some people do better in a smaller group. Some people prefer larger. The facilitator should go over exactly what is the agenda of the group, how it's run, and who should be in that group. And then does the facilitator explain the confidentiality guidelines and move people along so that one person is not dominating the group? Do you feel welcome and safe? And then you might want to consider, if you're going to do something online and you want to be anonymous, maybe make sure you don't have your full name up on your video, or you may want to not even use the video aspect and just use the audio, but also make sure that your full name is not there if that's important. And then in-person groups often, especially 12-step programs, you would only use your first name, and you would, it would be explained that nothing is to be shared outside the group except your own experience. Can you please advance to the next slide? So I just put together just a sampling of some of the community groups that are available. Obviously I can't put every single support group that exists on the planet, but these are some that we refer our patients to quite frequently. Can you advance to the next slide, please? And then I wanted to, on this slide, just point out that if you're looking for a specific type of support group, you can go to each Mass General Brigham site and go to their website to see what they're currently offering for their support groups. And they usually have a description, you know, whether it's time limited, whether it's for a specific population, for a specific disease, and or for a caregiver. And then I just wanted, this was all the sites that I could think of under Mass General. But if there are others, you know, you might be able to check with you if you belong to a, you know, primary care physician group. You might want to check through there as well. Next slide, please. And then just here's an example of other support groups. Sometimes people prefer to go outside of the Mass General Brigham network to increase anonymity, or perhaps they live in a different location and or they just have something more specific that you are looking for. And there are, you can find them, you know, specific support groups for specific mental illnesses, as well as other specific programs. And then on the bottom, I just included a COVID-19 support group that is virtual. Unfortunately, you know, Spalding did have a support group for COVID-19, but it just ended. So that was the only other one I could find. Which just brings me back to the point that keep looking for support groups, because they come and they go. So just because something doesn't exist today doesn't mean it won't exist tomorrow. Next slide, please. And then I just wanted to draw attention to non-traditional groups, or groups that really are not support groups, but they could support your mental health. So, you know, keep in mind that if there's something you really enjoy doing, or a way to connect with other people, think about your interests or hobby groups, your professional groups. For example, the NASW, National Association of Social Workers, APTA, the American Physical Therapists Association. These are all, you know, whatever profession you're in, there's usually a professional group for that. And it might be nice to connect with other people in your profession that are maybe struggling with everything that's been happening in the world the last couple of years. Keep in mind, civic organizations can do something good for the community as well as for yourself and your own mental health, similarly to volunteer work. And then even a church group, if that's what inspires you and keeps you going through all these difficult mental health challenges. Next slide, please. Oh, I guess that's it. So I'm going to turn this over to Owen Wyatt in the Employee Assistance Program.
Okay. Hi, everyone. My name's Owen Wyatt. I'm a licensed mental health counselor, and I'm an EAP consultant at your employee assistance program at Mass General Brigham. And so I'd like to just use the rest of our time, hopefully some time for some questions as well, to share with you just an overview of your employee assistance program and work life resources. So we're a free service. We're also internal to Mass General Brigham, and we're located at 10 of our hospital campuses throughout the system. We're also confidential, and so that's really important to emphasize, because I want to assure you that if you do use our services, we're not going to tell your manager that you came in. You certainly, if you feel comfortable, can share that to your manager, but we would never disclose that. There's also no record of your having used the EAP that's noted in PeopleSoft or your HR personnel file. And we also don't use Epic. We use an entirely different electronic record keeping system, so that if you do use the EAP, there wouldn't be any notation about it in the Epic record. We of course can arrange, if you want us to speak with someone in your life, we can provide a release of information for us to speak more openly with say your HR business partner or a community provider to help coordinate care. But you're in complete control of that, and it's also it's your prerogative if you choose to redact that release. It's completely your decision. You're likely aware of the exceptions to confidentiality, but just important to state them here. They are rare, but the only reason we would ever break confidentiality is in scenarios that were relevant to any imminent risk of harm to self or to others, or anything that is a significant and ongoing infringement upon someone's basic human rights, like elder abuse or child abuse or disabled abuse. So in circumstances like that, we will break confidentiality in order to protect the vulnerable. But outside of those scenarios, it's completely confidential. You'll see here we're also voluntary, and so that's important to emphasize as well. So if your manager notices that you're having a difficult time or is concerned about you, they may recommend that you schedule an appointment with the EAP. But again, that's completely your prerogative. And so even if you choose not to follow through with the EAP, there's no penalty for that. There's no negative repercussions, and you're in complete control of whether you choose to access us or not. We're also an expanded benefit, so we're not just a benefit for you as the employee, but we're also a benefit for your immediate family household members. So any family members living in your home also have access to EAP services. We're staffed by licensed master's level social workers and mental health counselors, and we provide appointments by phone, in person, and by video. We also have specialized expertise to provide consultation to managers and to support employees and work groups who are impacted by adverse events. So that's another area where we might be able to provide support to you. So these are instances of, say, critical incidents, unexpected loss of a coworker or a patient, and any other safety concerns. We can also provide consultation and training to managers to assist in supporting and referring employees to the EAP with personal or work-related concerns. And then lastly, down here at the bottom, we also offer educational webinars and seminars, programs for just a variety of topics such as stress resiliency, parenting, elder care, financial education, and actually just coming up on April 6th from 12 to 1, we have a webinar promoting wellness and healing for people of color, which is facilitated by Dr. Charmaine Jackman, who's a Harvard-trained adolescent and child psychologist with over 23 years in the mental health field. This slide here, it's an overview of the type of issues that people seek help out for with the EAP. You can utilize our services for really any work-life matter, whether it's an active emergency or whether you're simply looking for, say, dog parks in your neighborhood. So this is why we like to say that there's really no problem that's too big or too small. So don't worry if the challenges that you're going through are not acute or are not urgent. You know, we're here to help you no matter what your concerns are, and really welcome you to follow up and reach out to us and schedule an appointment. Some of the personal concerns people call about are listed here. So these include stress or grief, family or relationship issues, job stress, stress related to our pandemic. Or employees may contact us because they're feeling depressed or anxious, or some may feel unsafe in their relationship, and we can provide a safe and confidential space in order to provide support, but also to review resources that are available and to help come up with a plan moving forward for therapeutic support. Just briefly, when you come to the EAP, we'll assess your situation and how it's impacting your personal and work life. We can provide support and problem solving, and we can recommend various options to address your specific needs. We may work with you short term, or if you would benefit from a referral for longer term insight-oriented therapeutic support, we can assist and help identify resources that are available and would be a good fit for your situation. Oh, I'm sorry, I'm going to go back. Some just additional resources that we provide. We can also provide assistance and direction to those struggling with addiction, and for those people who care and love those individuals. We're a good resource for workplace issues that may come up. So that's because we're an internal EAP. We're familiar with the options available through Mass General Brigham, and we know this work environment well. So know that that's a support that we can provide as well. We can provide assistance with legal or financial assistance. We can help with parenting or elder care concerns, including assistance in finding childcare or elder care. And we also offer lactation support services for new mothers returning from maternity leave. We have lactation rooms available in locations across Mass General Brigham. So when you're ready and you're returning to work, you can contact us. We can provide sort of a mini orientation of how to access those rooms, and you would be able to access via your badge. So know that that's available too. So now onto this slide. So this is our EAP website. This is the main page. This is actually a new website. We unveiled it last year. And whether you schedule an appointment with us or not, I encourage you to check out our site. It's at eap.partners.org, and please consider it a resource for both your work and personal challenges. Up here on the right, you'll see language is circled. The site translates into 100 languages. So if English isn't your primary language, you can select your language and transition all the content of the website into your primary language. This turquoise bar kind of up here at the top, the appointments and contacts. That's how you would set up an appointment online rather than calling us. So that, again, that's in our appointments and contacts section. And then you can see here, sort of in the middle of the screen, we have really a robust variety of resources, and they're organized into these topic buckets here. So including well-being and mental health and addiction, financial or legal, housing, caregiving, family. You'll notice down at the bottom right, there are self-assessments, anonymous self-assessments that are available to you, where you can access both mental health screening as well as work-life balance screenings. Our disability resources can be found in the diversity, equity, and inclusion section, right to the left of the self-assessments. So that includes resources on race and ethnicity, social determinants of health, information relevant to the LGBTQ community, and as well as disability and access. And then lastly, we have over 400 mini articles on an array of topics from parenting and relationship issues, stress management, anxiety, and depression, and so on. So please, again, consider our website a resource. And again, it's at eappartners.org. So how do you make an appointment at the EAP? Again, like I mentioned earlier, appointments are available in person, by phone, or through video. Most of us work 8 to 5, but some of us come in as early as 7 a.m. and some of us leave as late as 7 p.m. And that's to accommodate specific appointment requests, and we try to cover as many shifts as possible. You can call or schedule. You can call to make an appointment, and like I reviewed, you can also schedule that appointment through our website. We have Spanish, Haitian Creole, and French-speaking counselors on our team, and if those don't represent your primary language, we can access the Mass General Brigham translative services to provide support. We also have counselors on call for more intense crisis-oriented issues that can't wait. So that's both over our hours of operation during the day, as well as overnight hours. So this is available to both you as an employee, but also to managers in the event of any employee or workplace crisis. And you would access on call by calling our main number. You can access both by just calling that one number. And then this is a list. I had mentioned the 10 locations across Mass General Brigham where we have on-site locations. Okay, so if there were ever a time to be aware of additional mental health resources and tools that are available to you and your direct household members, the last 2 years certainly have been it. And I know we're going to provide a link to a more full handout that outlines wellness and resilience resources that are available internally to our system. But I wanted to make you aware of just a couple of them here. So the first is a resource called Silver Cloud, and it's a free online self-directed course in cognitive behavioral therapy, and other well-being activities and it's best suited for individuals with anxiety and or mild to moderate depression, insomnia, or stress, and a good resource if you're looking to develop new strategies or hone strategies that you may have already developed, and as well as to build resilience. So you can access Silver Cloud through this link. Again, it's going to be on the handout that we'll provide. And then this is the code that you would use, MGB 2020, to access your free account. Another resource that some of you may have heard of is a app called Headspace. So this can be used obviously on your phone for mindfulness-based exercises such as meditation and guided relaxation exercises. And again, you can sign up for free. This is access to the paid account. There's a free version and there's a paid version. And all employees at Mass General Brigham have access to the paid version for free. So this is the link that you would use in order to enroll. And even if you already have a paid Headspace account, it's possible to transition it to a free account. So please know that this is available, and this bottom paragraph speaks to the benefits of mindfulness to reduce stress and anxiety and to improve wellness. So lastly here, our medical director at the EAP, Dr. Herman, he likes to say, don't worry alone. And I think that's a good mantra for all of us. So please know that we're here to support you through whatever stress you're going through. Please don't hesitate to call or set up an appointment online, where your confidential and free and voluntary employee assistance program for you and your immediate family household members. So thank you very much, and happy to field any questions. And I'm going to hand it over to Colleen to wrap us up.
Awesome. Thank you, Owen, and thank you to all of our presenters. This is such helpful information. We do have a few questions. Owen, I'll start with you just because you were just chatting. Someone is asking, are EAP sessions charged to medical insurance? I believe.
Oh, that's a great question. Yeah, that's a great question. No. So this is a free benefit so it's part of your benefits package, and so you can access us for free. We provide short-term care. So if you're interested in something more long-term, we can provide interim support, and then we would assess your needs and connect you with appropriate therapeutic care in the community. And in that case, with a referral, that's when your insurance would kick in and be charged. But to note that we would provide resources that accept your insurance, so you wouldn't be paying out of pocket, and you would be covered by your copay.
Fantastic. Thank you, Owen. We do have someone else who asked for a copy of all of the great resources and support groups that you all shared during your presentations. Will it go to the participants today? Yes, it will. Amy in our chat just shared, if you look at your chat box, she just shared an Apollo link. Apollo is the Mass General intranet site. She shared a link covering all of these resources mentioned in today's presentation, and we also will include a recording of today's entire presentation on there as well once it's ready. So it's not there right now, but feel free to check back by the end of the day tomorrow, and this recording will be there as well as the slides and all of the resources listed for you all to reference. One additional question for Karen. I see you answered it here, but if you wouldn't mind answering it to the group as well. Someone had asked if you need to be a Mass General Brigham patient or employee to join all of those great support groups that you had listed, Karen, and if there's any cost to join.
Okay. So the groups that were listed on the first slide of groups, those are all open to the community and there is no cost associated with them. And you'll have to look at the individual groups that are at the other locations. Most of those I think are open to the community, but some of them are specific to, like, for example, only Dana-Farber patients may be in some of those support groups. You also have to check to see if there is a cost associated with any of those, but probably most of them are free.
Great, thank you, Karen. I know we're at the end of our time, but one more question just came in. I'm just gonna ask it here and I'll say to this person, we'll add any of these additional resources to that Apollo link page. So we have a question. If other programs exist at MGH that specifically promote physical activity for patients and or employees with disabilities, I would guess that our panelists and or Zari here do know of ones that exist. So we'll be sure to add those to the resource page on Apollo for reference after this presentation. So I think that's all for today. Thank you all so much for joining in, for your questions, for listening. Thank you to our presenters. This information is so great, especially, you know, these days, but anytime at all. So we will add, again, any more resources we can to this Apollo website. Please feel free to visit there. And thank you again.